So yet another clinical experience with migraine. Most of the patients who suffer from this headaches being females, it is another 34, 35-year-old girl who came to me with severe pain. The quest in migraine is to treat it immediately and solve it with one dose or maybe just a few doses. Now this lady who came to me had a similar aggravations which we all see in our day-to-day practice, that you go out in sun and the whole problem aggravates. She too also had walked in the sun and the pain started. She tried taking initial painkillers, but that won't subside her headache. So I asked her, tell me more about the pain, and the pain was very typical. She said that the pain traveled on the left side, on the whole of the left side was paining. She couldn't lie down. Slightest noise used to aggravate a problem. She couldn't tolerate the lights. She was extremely restless, and this pain went on for a long time. So I asked her, does anything make you feel better? And she says that applying cold on the forehead makes me feel slightly better. So I asked her, anything more that you can tell me? She says, every time I get this episode of pain, I get an urge to pass stools. I pass stools satisfactorily, but this urge is very common. I asked her to describe more. She says that whenever the pain is very severe, I get hot flushes on my face. Now, after seeing this, maybe I must have viewed the Materia Medica at that time and prescribed a remedy which is very unique in our Materia Medica. Though we don't prescribe for headaches, but something that helped me in this was entirely different. I prescribed her Aconite 1M. After taking one dose of Aconite, the first thing that she gave me as a follow-up within an hour is that, sir, the gloominess, the sadness, the depression that I had with this headache, that has also disappeared within that one dose. She said every headache would get me into a kind of depression which would make me feel sad, gloomy, not able to think anything properly. That disappeared along with the pain. So what was the understanding? Why did I prescribe her Aconite? Now, every time the trigger is the sun. In most of the cases of migraines, the sun or the heated rooms are the triggers. But where it expresses itself decides the uniqueness of the individual. In this patient, that trigger, the exposure to sun, triggered a nervous and a neuromuscular phenomena. So what was that nervous phenomena? You could see that she had flushes of heat. The headache was better by applying cold. So there was some sensitivity to nerves. Again, better by applying something cold, by soothing the nerves. There was already a depression and gloominess and the urge for the stools every time she had this headache. Now this particular trigger, which is a nervous expression, is a hallmark of the Ranunculataceae family. Then the headache better by cold applications was one of the very important indications. When you understand the exact physiopathological journey and the concomitant systems involved in the chief complaint, you will come to a uniqueness of the constitution. So here the aconite was not the remedy for the headache, but it changed something much deeper. The sadness, the gloominess, which was a part of her constitution, which triggered and lingered for a long time, disappeared with this one dose of Aconite 1M. So my dear friends, every case of headache may not be having only modalities. There may also be a journey. There may also be a physiological understanding, an expression of concomitants along with the pain. You need to see this at the single spectrum, and that decides the remedy. Thank you.